Good evening. It is welcome news for some hospital workers. After what was a difficult fall, we're hearing that some emergency rooms were much calmer than expected on what would typically be the busiest day of the year.
it, it's busy, but it doesn't seem to be abnormally busy.
Hospital staff bracing for a surge of emergency room patients this Boxing Day are breathing a sigh of relief.
The blizzard over the weekend sort of slowed down contact, so that might actually slow things down for us a bit.
It appears to be the calm after the storm. This fall, the healthcare system was overwhelmed by a triple threat of viruses and staffing shortages that forced some hospitals to close their emergency departments and critical care units. Infectious diseases physicians tell us it is still too early to know for sure, but cases in Ontario and across the country may have peaked.
The RSV waves in Canada looked pretty convincing that it was not getting worse and it was actually getting better. I think from an influenza standpoint, we're probably peaked.
In Australia, the flu season started earlier and ended earlier. There is hope the same is happening in Canada. Flu cases in the United States also appear to have peaked, so doctors say it wouldn't be surprising if Canada were to follow. But it is important to remain vigilant.
Even if we have peaked, it's a long way down the other side of the mountain, and there's still a lot of influenza out there.
The Ontario Medical Association says influenza A is the predominant virus affecting children this season. Children's hospitals like Sick Kids in Toronto have been under immense pressure and above occupancy for months. They've even been forced to cancel surgeries to redeploy staff to care for emergent patients. But there is good news on that front too.
I'm happy to report that we have returned back to our seasonal norms over the past couple of weeks, and that's important for parents to know.
On average, their seasonal norm is about 230 patients per day. Wait times in the ER will fluctuate and might still be long, depending on the severity of illness. But doctors say it's important to know emergency departments are safe for children, and the initial triage assessment is highly valuable.
If you find yourself waiting in the emergency department, know that it's because a highly specialized person, a highly trained nurse has assessed you, taken your vitals, and has deemed that your child is safe.
And even though this weekend was quieter than expected, the next few weeks are critical.
The Christmas holiday itself is quiet, but after Christmas is our busiest time of year. Having, all these viruses attacking at the same time is not going to help.
And a reminder that there are flu and cold clinics available throughout the city, and they're open throughout the holidays, a great alternative for parents. Sick Kids also has a slew of digital tools on their website to help parents decide when an emergency room visit is needed.